Hi there, and welcome back to another COVID-19 webinar hosted by American Society of the University of Haifa. We're joined once again by Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership, to provide you with the latest news surrounding the COVID-19 pandemic and answer any questions you might have. Dr. Green, great to have you back with us as always.
Thanks, James. Good to be with you.
Excellent. Now, we're going to touch on a number of hot button issues today regarding booster vaccines, understanding antibodies and immunity, travel restrictions, and child vaccinations. And hopefully we'll be covering a lot of the questions and concerns our viewers have had over the past week or so. So first off, Dr. Fauci said over the weekend that there is no immediate need for a COVID-19 booster for fully vaccinated Americans, while at the same time, drug maker Pfizer has been lobbying for a third vaccine to protect people from variants. Additionally, Israel is now offering a third dose of Pfizer to adults with weak immune systems. Dr. Green, where do you stand on booster jabs being administered, and when do you think they should be offered to the general public?
Right. Well, thanks, James. I think that one thing that COVID's done is that most of the population, or at least a big percentage, have become both epidemiologists and also immunologists. So they understand now epidemiology and also quite a lot of immunology. So we'll just talk very briefly about the immunology. When you give a vaccine, you basically are introducing what's related to the virus, part of the virus, so that your body will recognize it and produce antibodies. And it's a complex process of a so-called memory process. In other words, you develop a memory for that particular virus, or in this case, the SARS-CoV-19. So once you have that memory, you have cells that produce antibodies, which are stimulated. They're actually specifically developed to produce these antibodies, which will then help to neutralize the virus. But the question really is, why do we, when we now remove the virus, in other words, you're not exposed to it, why do we continue to produce antibodies? And that's, it's also a fairly complex process, because in a sense, it doesn't really make sense, because you would say, well, once the virus is not there, you shouldn't be continuing to produce antibodies. So what happens basically is that with some of these viruses and with vaccines, you're not producing many antibodies, and you've developed a memory response. In other words, you have that in your memory, but you're not continuing to produce a lot of antibodies. And we see that often with the so-called either inactivated vaccines, particularly, or the ones that are synthetic, so to speak, or recombinant. And one example, for example, is hepatitis B, which is a recombinant vaccine. And so what you have is a vaccine which basically is part of the virus. And for the hepatitis vaccine, we give 3 doses generally, usually at 0, 1 month, and 6 months. But we can sometimes give it at 0, 1 month, and 12 months. There's no fixed law about how many doses you actually have to give. It very much depends on the kind of vaccine. Hepatitis A, for example, you might only need 2 doses, and some occasions we only give 1. So it really is very much dependent on how good that memory response is. So the question now about the booster for the COVID-19, we know that this vaccine, certainly the mRNA vaccines of Pfizer and Moderna, but some of the others are producing a very strong antibody response, and it seems to have a good memory response, in other words, remembering. The question is whether we're seeing a decline in antibodies, and that the decline that we are seeing is simply the usual decline that you see because you're not exposed to the virus, but you still have the memory, or that there is a problem that we are losing some of that memory. So the question now really is when to give the booster, if you need a booster. So there are 2 things that we would decide on. One is we would follow this decline in antibodies and see whether that correlates with anything in terms of infection. But more important, we would want to know whether there are breakthrough infections. In other words, people who are vaccinated who are getting sick. And that is happening. It's also not entirely unexpected, because a small percentage are not fully immune, even having had the vaccine, because we know the vaccine is not 100% effective. And the other thing is that they're not generally getting very sick. So basically, if the aim of the vaccine is to prevent serious illness, and we're not really too concerned about mild illness, then we're not too concerned now about giving that booster at this stage. We certainly would say that we don't want to give the booster too early. We would want to see what's happening, and it's usually better in most cases to wait a little while. So this is basically, I think, what's happening at the moment. The one final thing, there is a select group of people who have a defective immune system. In other words, they're immune compromised. And those people have not probably generated a good immune response to the first 2 doses. And this is the reason why you may want to give them now a booster just to get them up to what other people are getting.
Right, and that's something we'll touch on just shortly, actually, in more detail. Yeah. For now, though, we've touched on this in the past, actually, but a range of vaccines now, have been circulated, being given to various people around the world. Is COVID-19 vaccine mixing a good thing for these booster jabs, or should people be sticking to the same vaccines they've received previously?
Again, I think we'll start on the other end and say, is it a bad thing? In other words, is there a problem? Can it be dangerous? Well, the answer basically is there should be no problem. I mean, if you think about it, we vaccinate with something to prevent you from getting disease from something else, which is the actual virus. So in other words, we're mixing in that sense, because the actual virus is not the same as what we vaccinate with. So that's not an issue in terms of safety. We recognize that, and it would be very. The question here would be which kind of mixing you use. Obviously, if I give you a vaccine that has lower protective efficacy, in other words, it's less effective, and then another one that's more effective, then combined, they'll be better than the first, basically. If you can use 2 highly effective doses, then obviously that sounds better. Yeah. The question, some people will say, well, maybe actually giving another kind will actually have a different kind of stimulation. If it could in some senses, but for example, it wouldn't make any sense if you said using Pfizer first and Moderna second, because they're basically the same technology. Mm-hmm. You may argue that there may be some kind of influence of giving first Pfizer and then an inactivated vaccine or something like the Chinese one or the AstraZeneca. But, it's speculation. I think the answer basically is there's no real problem in mixing. Better to get the best vaccine, 2 doses of the most effective vaccine. But it's not a problem if you get one less effective and then one more effective, you could certainly have it. There's no danger. So at least there shouldn't be at all.
Gotcha. And coming back to what you were just starting to mention about antibodies, we've actually had a number of people who have recently been taking serology tests, which look for antibodies in your blood that fight the virus. Largely this was due to travel requirements in certain cases. The question that keeps coming up here is, does a low presence of antibodies indicate a low immunity to COVID-19?
There is some correlation clearly between the level of antibodies and protection, or there could well be. But that correlation doesn't mean that people with a low level are not protected. And again, we go back to the other vaccines or other diseases where you know that after a period of time, the actual antibody levels are very low. But if they are exposed to the actual virus, or if it could be a bacteria, if it was a bacterial vaccine, but to the virus, there is an immediate, what we call a memory response. And that's basically what we want. The idea of getting vaccinated is basically to get your immune system operating quickly. It's not really different, because if you get exposed to the actual virus having not been vaccinated, you'll develop antibodies. But it'll just take time, and during that time, the virus can do a lot of damage. So the idea here is to say, wait a second, let's do it so that the body is ready, recognizes it immediately, produces the antibodies, or has it. So it doesn't mean to say that you have to have the antibodies, but you do have to have the ability to recognize that virus and produce antibodies quickly. So I wouldn't say a low antibody level would not necessarily mean that you don't have a memory response. It could possibly mean that you didn't develop an adequate response to the first dose or second. And I go back to hepatitis B. There are no non-responders in that vaccine. So we know that a small percentage of the population will not respond to the vaccine. And sometimes we actually give them another 3 doses. So, we give them again to try and boost it. I'm not just talking about people who have immune deficiency. It's a kind of a genetic factor. So again, that's not impossible that here we have a small percentage of the population who will have very low antibodies because they didn't respond well. But you can have a lot of people who have low antibodies, but their memory response is good. In other words, if you expose them, they'll very rapidly produce antibodies.
Right. Okay. Thank you for explaining that. That is a complex, I guess, analogy where a lot of people have been confused over that, thinking that, I think a low immune antibody level would indicate a low immune system. That's good to know, and I hope our viewers are able to take knowledge from that.
I often say, by the way, that the immune system is more complex than the brain. People will argue with you in the neurology, but it's an amazing system, the immune system. And it's a very complex and very, very intelligent in many respects. It actually is an amazing system in many respects.
Yeah. So moving on, Israel announced yesterday that it most likely won't open its borders to tourists until September, moving from its original date in July. Do you think September is a realistic and safe time to open up, or is this wishful thinking?
I think we need to look at what's happening in other countries and then say, pretty much argue what is the right path. Opening the borders is not so much a question of allowing more cases in, because that's probably not not going to make a big difference if you already have cases. But it certainly might introduce new variants. Mm-hmm. That doesn't mean that you can't, test for them. And certainly we would improve the testing process at the borders, people who when before they leave their country of origin, when they arrive, all the things that we're doing, and make sure that those are in place. So the concern would be basically introducing new variants and then having to deal with them. But we're going to have to live with this virus. I mean, this is not going to go away soon, and it may be with us for years. So you're not going to lock our borders for years. So we really have to start putting in place some system. The one thing you would have to ask, and I could ask you from your basic origins in the UK, what is the actual plan in the UK? They're talking about the possibility that they'll be having 100,000 cases a day and living with it. So it's true that most of them will be young people and not people with comorbidities and so on. So they may not impact very much on the hospital system, or let's assume that it doesn't. But it doesn't mean that that virus is going to be circulating very widely, which means that it does have the opportunity to mutate. But then you could argue, well, that's what we are. That's the world at the moment. I mean, the whole world is full of the virus. So each country has to really decide what they want to do. I would say that we have to be very pragmatic and follow very carefully the cases here, just to see that we're not doing anything to the health system, making sure there are not too many serious cases, and but trying to get back to living a normal life. I mean, I think that's very important. We mustn't forget that.
Right. I would agree. So final question, Dr. Green, Israel's health ministry is also debating whether to administer the vaccine for children under the age of 12. Now, we've touched on this topic in the past as well. What are your thoughts about this, and how necessary do you believe this step is to limit the rise in cases within the country?
Okay, I'll be a little controversial here and tell you that I may be a little bit different from some of my colleagues. I think the main thing when we give vaccines to children, which is true for vaccines generally, when you develop a vaccine, you basically are looking at two issues. We're looking at the amount of vaccine you need to give to produce protection. In other words, to create a situation where your body responds and produces antibodies and so on. It stimulates the memory response. And the other is to not have too many side effects. I mean, a vaccine that causes you to be very sick is not a good vaccine, because that doesn't really achieve the purpose. And that's what we call reactogenicity. It reacts, basically, the reactiveness. So what you would argue is if we're giving it now to younger people, and we have seen that the reactogenicity, the side effects appear to be higher in younger people, and that may well be very much associated with the response, the immune response, stronger immune response. So what I would say about children here is that we have to make sure that this vaccine is not too reactogenic. And this is where we need to really start testing doses. And I've said it before, that I think that in the future, we need to even look at the doses we're giving into the under 30s, because in some respects, it is a fairly reactogenic vaccine. It's very immunogenic. I'm talking again, very much about the Pfizer and Moderna, the mRNA, because the others are maybe a little bit less so, but let's just focus on those that are very immunogenic. They, you produce a very good antibody response. So I think we need to start looking at lower doses, and I think this is in fact what's being done. So once we've got a good dose regimen for the children, where we don't have too many side effects, right, then that would be the time to vaccinate. And that I know is in process now. There are groups looking at it. But I think that's the thing that we need to wait for, to make sure that we're not giving a vaccine that has, I'm not even talking about side effects that are dangerous. I'm talking about, you don't want to have your kid sick for 4 or 5 days because they had a vaccine. That's not a great vaccine. You'd like them to have as few side effects as possible, and certainly not serious ones. So I think this is something that needs to be tested very carefully. And I would, again, personally, I believe in, and I'm modifying the dose, but again, people will come back to me and say, show me the data. Well, the data is still to come in, but this is my feeling, at least at this stage.
Right.
This is also based on some of the phase 1 and phase 2 studies, where you can see that the immunogenicity doesn't differ very much with doses, but there is an increase in side effects when you increase the dose, which is true just about for many vaccines.
Yeah, that makes sense. Great.
Right.
Dr. Green, thank you so much as always for your insights. I'm afraid that's all we have time for today. As always, if anyone here does have any questions for Dr. Green, please do leave them in the comments section of this video, or email them to info@asuh.org, and I'll be happy to address them at a later date. Thank you all so much for tuning in.